ultimately leads to cross-linked fibrin formation, and platelet immediately forms a plug at the site of injury. So there are two type of hemostasis, primary and secondary. Primary hemostasis is that in which there is initially a plug formation at the site of injury, and secondary hemostasis when there is the involvement of the factor 7 especially in response to the fibrin, right? Disorders of coagulation are diseases states which can result in problems such as hemorrhage, bruising or thrombosis. जब coagulation ज़्यादा हो जाती है, let's say pathology हो जाती है, coagulation is a physiological process, but when it exceeds the limit, it leads to pathology such as thrombosis, hemorrhage, and clotting disorders. So for coagulation, you have two pathways, right? One is the intrinsic pathway, second is the extrinsic pathway. Intrinsic pathway when there is the injury in the vascular endothelium, and it is the slower and more important. Extrinsic pathway, it is the when there is damage to the external, you can say to the, by the external stimuli, or when there is damage which is external to the endothelium. जो tissue injury होती है, in that injury extrinsic pathway is more involved. So while intrinsic pathway, it is initiated by the injury in the vascular endothelium. This is slower and more important. Extrinsic injury and then activation of tissue thromboplastin. दोनों pathways को अगर देखा जाए, when there is involvement of factor 12, factor 11, factor 9, factor 8, when there is involvement of these four factors, this is intrinsic pathway. And when there is involvement of factor 7, which is tissue thromboplastin, this is extrinsic pathway. After that, the both pathways, they join and they have a common pathway, that is the activation of factor 10. Factor 10 activates into 10A. This 10A activates the factor 5. This factor 5 activates the prothrombin, 2 thrombin, and then thrombin activates the fibrinogen 2 fibrin. So then the Vercoe's triad. Vercoe's triad is a triad that means एक तीन चीजों का combination है. It is designed by or discovered by Rudolf Virchow. He described the three factors that are critically important in the development of venous thrombosis. One is the venous stasis. Second is activation of blood coagulation. Third is vein damage. ठीक है? So when there is involvement of these pathway, जब pathology of these pathway, they leads to coagulation disorder and then Vercoe's triad. So today we are going to discuss the anti-clotting agents, right? Fibrinolytics or thrombolytics. We are not going to touch the antiplatelet drugs here. So anticoagulants includes heparin, direct thrombin. Let's divide the broad category first. So anti-clotting drugs are divided into three categories. One is anticoagulant, second is thrombolytic, third is antiplatelet drugs, right? So anticoagulants, which includes heparin, direct thrombin inhibitor, direct factor 10A inhibitor, and warfarin. To better understand it, so direct thrombin inhibitor, that means that if you can see in the common pathway, prothrombin is converted to thrombin via factor 5A. So if we inhibit this thrombin, okay, one is the direct thrombin inhibitor. Second is, as you can see here, second is factor 10A inhibitor. Factor 10A is the factor which is activated by both the pathways, extrinsic and intrinsic pathway, right? Then you have the warfarin and heparin. Thrombolytic agents or fibrinolytic includes tissue plasminogen activator derivatives, streptokinase, retiplase, LTplase, and tenactiplase. Then you have antiplatelet agents, which includes the glycoprotein, ADP inhibitors, that includes the clopidogrel, and PDE of adenosine uptake inhibitors. By the way, this chart is taken from CADSM. We will be going to discuss this case in the end. You have to be very alert. There will be an interactive session. So we have discussed it earlier that the anti-clotting drugs are divided into three broad categories. One is anticoagulant, second is thrombolytics or fibrinolytics that breaks down the fibrin or thrombus, and antiplatelet drug that inhibits the platelet aggregation, right? And anticoagulant that prevent the formation of blood clot, or if already clot is formed तो उसको degrade करता है. So anticoagulant agents, these agents, they inhibit either the action of coagulation factor heparin, right, or interfere with synthesis of clotting factor warfarin. So these agents, they inhibit either the action of coagulation factor heparin or interfere with the synthesis of clotting factor. So they inhibit the action of coagulation factor or inhibit the synthesis of clotting factor heparin. It is indirect acting anticoagulates the plasma antithrombin, right? Heparin is antithrombin 3 complex, inactivates the clotting factor 10A, 2A, 9, 12, and 13, but not activate the 7A. 7A is the extrinsic pathway. So basically, heparin has a role in intrinsic pathway. 10A mediated conversion of prothrombin to thrombin affected overall 10A and 2A mediated conversion of fibrinogen to fibrin, monitored by activated partial thromboplastin time. So uses of heparin: deep vein thrombosis, pulmonary embolism, acute myocardial infarction, used in combination with thrombolytics for revascularization. When a clot is formed, the blood flow to the vessel is compromised, right? But जो lumen of the vessel होता है वो narrow हो जाता है. So for the revascularization, in combination with glycoprotein 2B 3A inhibitors during angioplasty and stent placement. So adverse effect when heparin is given, right? क्योंकि एंटी क्लॉटिंग एजेंट है तो ब्लड क्लॉटिंग नहीं होगी, उसको इनहिबिट कर देगा. जब ब्लड क्लॉटिंग नहीं होगी, ब्लड क्लॉट नहीं होगा, देयर विल बी मोर रिस्क ऑफ bleeding due to overdose. Hematuria is the first sign, right? Thrombocytopenia, that is aggregation of the platelet. Thrombocytopenia होगा, platelet utilize हो रहा है. Hypersensitivity, urticaria, rigor, fever and anaphylaxis. हर medication का एक allergic reaction होता है. Alopecia and osteoporosis. Contraindication includes bleeding disorders, severe hypertension, GI ulcers. If there is a GI ulcer या colonic diverticula है, so there is more risk of bleeding, तो उसमें avoid करता है. Hemorrhoids and malignancy, ocular and neurosurgery, chronic alcoholism and cirrhosis. So the effect of overdose of heparin can be neutralized by protamine sulfate. Come to another class, which is direct thrombin inhibitor. I have made a chart which summarizes it better. You have on your extreme left, you have the parameters. Then you have the drugs on your right, such as bivalirudin, lepridin, and argatroban and dabigatran. So class is they all belongs to bivalent except the argatroban, which is a univalent. This is their covalent binding. Then administration PCI, and PCI in patient percutaneous intervention. In patient with HITs, heparin-induced thrombocytopenia, lepridin is used as an anticoagulation in heparin-induced thrombocytopenia. They both argatroban is also used for that, and heparin-induced thrombocytopenia, and dabigatran is used for stroke prevention due to clot formation. Time to peak concentration, that is their time of action or mechanism of action, starts from zero 0.5 to 1.5 hours. It takes 2 to 4 hours for argabatrin. Clearance, they all are cleared by renal clearance except the argabatrin, which is cleared by feces, excreted out by feces. So monitoring, sub activated partial thromboplastin time के थ्रू मॉनिटर किए जाते हैं, because they all affects the intrinsic pathway. Then you have direct factor 10A inhibitor. Rivaroxaban and apixaban, these are newly discovered anticoagulant agents. Mechanism of action, oral inhibitors of factor 10A. Factor 10A is a factor which is activated by both the pathways, intrinsic and extrinsic pathway, right? It prevents the conversion of prothrombin to thrombin. So factor 10A is an important factor because it converts the prothrombin to thrombin, which is a common pathway element for both the intrinsic and extrinsic pathway. Then the uses are, it is used for the prevention of deep vein thrombosis, pulmonary embolism, stroke in patients with atrial fibrillation, and already patients who have a known cardiovascular disease and you want to prevent them from pulmonary embolism. So no laboratory monitoring required for these patients when rivaroxaban is given. Side effects, bleeding, as you know that they all are anti-clotting agents, so the side effect will be bleeding, excessive bleeding. Contraindication, renal dysfunction, and no antidote is available for direct factor 10A inhibitors. Oral anticoagulants, warfarin. So warfarin is a competitive antagonist of vitamin K and lowers the plasma level of vitamin K dependent clotting factors. So vitamin K dependent clotting factors are 2, 7, 9, and 10. You know that they are important in both the pathways. 7 is for the extrinsic and 2, 9, and 10 for the intrinsic. So synthesis of clotting factor diminishes within few hours at different times by different factors, but anticoagulant action starts within 1 to 3 days. This anticoagulant action is about the warfarin. So warfarin, again, it's a anti-clotting agent. Anticoagulant has, so the risk of bleeding will be increased. That is epistaxis. The patient can present with epistaxis, hematuria, that is blood in urine, bleeding from GI, intracranial hemorrhage, alopecia, dermatitis, and diarrhea. So for that you have to monitor the patient, and for that you have to give the vitamin K. जो एंटीडोट है, beside that अगर ज़्यादा bleed कर जाता है patient, we have to transfuse the blood. Contraindication are same as heparin. If the patient has GI ulcers, hemorrhoids, malignancy, ocular surgery, neurosurgery, or any other blood bleeding disorder. Beside that, fetal warfarin syndrome hota hai ek, which is presented by skeletal abnormalities in fetal such as hypoplasia of the nose, eye socket, hand bones, and growth retardation. There are certain factors which enhance the warfarin effect and which decreases the warfarin effects. Beside that, you have the drugs. So factors which enhance the warfarin effect includes debilitating nutrition, they enhances malnutrition, sorry, liver diseases, chronic alcoholism, like they enhances the warfarin effect. That means they can lead to warfarin toxicity too. Prolonged antibiotic therapy. Then factors decreasing warfarin effect such as pregnancy, nephrotic syndrome, and genetic warfarin resistance, and drugs enhancing anticoagulant action such as broad spectrum antibiotic, aspirin, which is a platelet antiplatelet drug, newer cyclosporin drugs. Beside that, you have chloramphenicol, allopurinol, tolbutamide, and phenytoins, and drugs reducing effects such as barbiturates. These are the drugs which enhance the anticoagulant effect, the broad spectrum antibiotic we were talking about. Then in the last, we have the drugs which reduces the warfarin effect, which includes barbiturates, oral contraceptives, rifampicin, and carbamazepine. This OCP is oral contraceptives. So far, we have discussed the coagulants, anticoagulants, right? So in anti-clotting drugs, we are done with anticoagulants, which includes heparin, direct thrombin inhibitor, direct factor 10A inhibitor, and warfarin. Let's come to thrombolytics. We know that heparin is indirect acting, it activates plasma antithrombin 3. It inhibits both the pathways, but not the extrinsic pathway. Heparin सिर्फ intrinsic pathway पे act करेगा. Then we talked about the adverse effect and contraindication to heparin. The effect of heparin is neutralized by protamine sulfate than direct thrombin inhibitors. Direct factor 10A inhibitor, factor 10A is the common one for both the pathways. Rivaroxaban and apixaban, they are newly discovered. Warfarin, adverse effects of warfarin, contraindication. We talked about the fetal warfarin syndrome. Then factors which enhance the warfarin activity, decreasing factors that decrease the warfarin activity, drugs enhancing anticoagulant properties of warfarin, then drugs reducing the effect of warfarin. Let's come to fibrinolytics or thrombolytics agent. So drugs that are used to lyse the thrombus or clot to recanalize the occluded vessel, coronary artery. Mechanism of action, it produces more plasmin, dissolves the fibrin thread. Drugs that comes in the category of thrombolytics are streptokinase, urokinase, alteplase, retiplase, and tenecteplase. Streptokinase is that was once popular drug, and it binds to plasminogen and generates the plasmin. So come to the fibrinolytic system. For the anticoagulants, we discussed the intrinsic and extrinsic pathway. Fibrinolytic system. So a plasminogen activator, that is tissue plasminogen activator, it activates the plasminogen to plasmin. This plasmin activates the fibrin to fibrin degradation products. Streptokinase, extracellular protein purified from group C, beta hemolytic streptococci. It formed the active one-on-one complex with plasminogen. Complex hydrolyzes fibrin plugs as well as clotting factor and factor 7. It is non-specifically activates the circulating fibrin-bound plasminogen, non-specific fibrinogen depletary, but less effective than the newer one in fibrinolysis. So streptokinase is less effective than alteplase, retiplase, and tenecteplase. They are the recombinant tissue plasminogen activator cultured from human tissue, and they are costlier than streptokinase. They are mechanism of action is that tissue-specific thrombolytic activity also interferes with circulating plasminogen and activated by plasminogen activator inhibitors. Plasma half-life is 5 minutes, and they are given via IV. For myocardial infarction, 10 milligram IV bolus, you don't need to remember the dose. For pulmonary embolism, so you need to remember the indications for alteplase and retiplase, but you don't need to remember the doses over the time. So tenecteplase, genetically engineered drug. It is higher fibrin selectivity. It has higher fibrin selectivity, not activated by plasminogen activator. It can be injected over 10 seconds and used as a single bolus. Tenecteplase. Alteplase, it has a low affinity for free plasminogen. It is fibrin selective and acts rapidly on plasminogen bound to fibrin. It has a very short half-life, 5 to 30 minutes. Urokinase, produced endogenously by kidney. As you say by the name, uro means related to some kidney renal system, and kinase is always with the inase is used for the enzyme. So produced endogenously by kidneys, therapeutic urokinase is derived from cultures of human renal cells. It has low antigenicity and it cleaves the arginine valine bond, of plasminogen. So uses of thrombolytics or fibrinolytics agent, they are used in acute myocardial injury, alternative to PCI with stent placement, aspirin and heparin co-administered to prevent the re-occlusion of the vessel. So the thrombolytics agent are given along with aspirin and heparin to prevent the re-occlusion of the vessel. It is used in DVT, that is deep vein thrombosis of the legs, pelvis, and shoulder, pulmonary embolism, and for stroke and ischemic heart diseases. Adverse effects of fibrinolytic agents. Hemorrhage is a major side effect. Altiplase may cause orolingual angioedema. It increases the risk of this side effect when given in combination with ACE inhibitors. Contraindication: pregnancy, patients with healing wounds, patient with history of cerebrovascular accident, that is CVA, brain tumor, head trauma, intracranial bleeding, and metastatic cancer.